Welcome to this tutorial on health literacy strategies and best practices, developed by the Medical Campus Learning Resources Department. The objectives for this tutorial are, to distinguish between health literacy strategies, identify plain language strategy rules, identify visual aids strategy rules, and identify teach-back method strategy rules. Let's start by learning about plain language rules. Plain language is writing that is clear and to the point, to help patients understand without unnecessary words or expressions. Let's look at some of the rules health professionals can follow when communicating health information to patients using plain language. Display essential information first, and avoid distractions when developing pamphlets, flyers or handouts for patients. As a general rule, reduce reading level of material or illustrated narratives. Avoid using medical jargon that patients can't read or understand. Use gender-free language. Eliminate unnecessary words. Limit paragraphs to 4 or 5 sentences, and skip at least one line between paragraphs. List information whenever possible. You can use bullets to summarize essential items. Also, leave a lot of white spaces within paragraphs. Do not use all uppercase letters or different types of fonts. This makes information for patients difficult to read and understand. Once completed, you can check your document readability in Microsoft Word. When communicating medical information to patients, avoid using medical terminology. Instead, use plain language that patients can easily read and understand. Consider this rule when developing visual aids, and during communication with the patient, using the teach-back method, discussed ahead on this tutorial. Visual aids are graphical representations such as charts, graphs, flyers, and handouts that help patients understand medical information. For visual aids to be effective, they must be transparent, well-defined, and accurately and clearly represent information. Visual aids must be easy to read and understand. When using visuals to communicate information, make sure they directly relate to the content. All visuals should contain titles and captions. Once again, avoid medical jargon. Visual aids should be clear and uncluttered. Place items without distractions. Once again, place important points first. Leave a lot of white spaces. Finally, use clear backgrounds with dark font colors to make information easy to read and understand. Through the teach-back method, health professionals ask patients to explain health information on treatment, drug therapy, and any other kind of instructions, in their own words. Keep the following rules in mind. Let patients know teach-back is not a test. Responsibility is on the provider, not the patient. Ask patients if information is clear. Review what you talked about. Follow these steps when using the teach-back method with a patient. Step 1. Summarize patient's information in clear, plain language. Say, high blood pressure, instead of, hypertension. Step 2. Ask patients to repeat the information in their own words. Step 3. Assess patient understanding. Was their response accurate? Are there areas the patient still doesn't seem to understand? Step 4. Ask the patient what you can explain better, and then clarify misunderstood information. Keep in mind that some of these rules apply to different health literacy strategies. For example, we can improve the patient's understanding of medical instructions on the correct treatment to follow, by avoiding medical jargon within plain language, visual aids, and teach-back method strategies.